Today we will be covering engine vacuum diagnosis. On a normal running engine, manifold vacuum should be between 17 and 22 inches of mercury, or inches of Hg, at idle, at sea level. There are many factors that can affect engine vacuum on an engine. These include the number of cylinders the engine has, as well as the elevation and barometric pressure. During a snap throttle test, an engine running normally should see the vacuum fall to around 5 inches of mercury as the throttle is snapped open. After the throttle is released, the vacuum should climb to a point slightly higher than idle vacuum and then return to normal. If the vacuum falls all the way to zero and only returns back to normal without the spike, it is likely the engine has worn piston rings. If the vacuum at idle is much lower than normal, it's possible the engine's valve timing or ignition timing is retarded. If the vacuum at idle is extremely low, the engine may have a leak in the intake manifold, the throttle body, or the gaskets associated with these items. If the vacuum readings bounce over a wide range, it could signal a leaking head gasket. This is due to the loss of suction from the cylinder as the intake valve opens on the intake stroke, bleeding off any manifold vacuum through the leaking gasket. Once the valve closes, manifold vacuum returns as the leaking cylinder is sealed off. If the needle on the vacuum gauge moves rapidly, the valve guides or springs may be defective. This causes the valves to not seal properly when closed, bleeding off manifold vacuum. These are just some of the common issues that can be found through the use of a vacuum gauge. The best way to become more proficient at vacuum diagnosis is to make it a habit of checking readings on vehicles that run normally, as well as vehicles with drivability concerns. If you have any questions, please post them to the forum titled Engine Vacuum Diagnosis. Thank you.